is outlining the provincial outlook for the year 2020 while also reflecting on the effects of the COVID-19 pandemic to government programs. Let's take you there now live.
And strengthening the state. Honorable Speaker and honorable members, regarding the task to defeat the coronavirus, there is evidence that we are beginning to win the war against this killer enemy. In January, the highest number of recorded daily infections exceeded 2,000. In the last few weeks, we saw a sharp decline. Our daily cases are now between 90 and 100. This certainly is a significant milestone. However, we are the first to emphasize that there are still many more battles to win before we can win this war. Part of these battles is the rollout of the COVID-19 vaccine. An overwhelming number of our healthcare workers are ready, willing, and excited to take part in the phase 1 of the COVID-19 vaccine rollout. Our healthcare machinery is equally ready for the vaccine rollout in line with the national plan. We have also been at work to empower the people of Limpopo with correct information about COVID-19 vaccination. This is important to counter the conspiracies and misinformation perpetuated mainly in the social media space about the vaccines. As part of our phase 1 rollout, we will use all our hospitals, excluding specialized hospitals, as vaccination sites. We will use all hospitals as vaccination training centers for all the clinics in the catchment areas. Each district has established mobile vaccination teams attached to the hospitals. Districts are working to ensure that all vaccination mobile teams are well equipped to conduct phase 1 vaccination. We have the capacity to conduct and complete phase 1 of the vaccination process within 2 to 3 weeks. We are working on increasing this capacity to reduce the phase 1 rollout period. Honorable members, we aim to vaccinate around 44,500 healthcare and related services workers during the first phase. This includes workers from non-governmental organizations that provides healthcare related services. Last week, we had a successful launch of the phase 1 of our COVID-19 vaccine rollout campaign. All indications are that our rollout of the first phase is a resounding success. So far, we have vaccinated over 4,000 healthcare workers. Honorable Butana Awon, Honorable Speaker, as I have said earlier, the coronavirus pandemic has severely impacted our economy. This was mainly on account of the lockdown measures and other restrictions which were necessarily adopted to bring the spread of the deadly virus under control. The adverse impact continues and is likely to remain with us for much longer. As Statistics South Africa correctly concluded, the personal, social and economic impact of coronavirus is unlike anything experienced globally in the past 75 years. Therefore, Madam Speaker, the focus of this address is on measures to alleviate the devastating coronavirus or COVID-19 impact on our economy. We will focus on the programs to reposition Limpopo on a trajectory of inclusive socio-economic recovery, development, and growth. Through partnership, focused attention, and hard work, our economy will rise from the ashes of the devastation caused by this coronavirus. We will rebuild our economy. We will rebuild the destroyed livelihoods. Above all, we will forge ahead to a destination for a better life. Honorable Speaker, we remain committed to the idea of using the muscle of state procurement to transform and diversify our economy, to allow more and meaningful, and this will assist us to allow more and meaningful participation of the historically disadvantaged people. During the year under review, we ensured that at least 19% of state procurement benefited women-owned businesses. About 12% of state procurement benefited enterprises owned by young people. Our target is to increase this number to at least 20% in the next financial year. At least, not only to 20%, Honorable Silan, at least, which therefore implies that more than 20% must go to young people. We will also improve the participation of people living with disabilities in the provision of goods and services to our government. Regarding our commitment to drive industrialization, we are revitalizing our industrial parks through a 40 million rand investment by the Department of Trade, Industry and Competition. We are refurbishing factories at the Nkuankua Industrial Park. These factories are now 95% complete. This intervention has benefited local small, medium, and micro enterprises. This initiative has helped to create around 174 direct jobs. The Nkuankua Industrial Park is currently at 88% occupancy rate. To date, the Nkuankua Industrial Park is host to no less than 823 direct jobs. The refurbishment of the Seshego Industrial Park has helped to benefit no less than 75 small, micro, and medium enterprises. The Seshego Industrial Park is currently at 85% occupancy rate. The initiative has created approximately 1,300 jobs. The Toando Industrial Park is at 91% occupancy rate. The project has created over 300 jobs, and we are hopeful that with increased capacity and more investment, more jobs will be created. Honorable Speaker, I know that as we talk about this creation of jobs, somebody down there who has been retrenched, somebody down there who has been looking for a job for quite some time will say, but ikai mishumo e Mathabatha bolelang ka yona. It will not always be possible to reach everybody. But as we increase and diversify the growth and the economic participation in this economy of ordinary people, lo wena mollo o tla go fihlela. Yes, we are making a dent to unemployment, but somebody will then say, but our unemployment rate is increasing. I always say to people, as and when the unemployment rate increases, please examine the rate of increase. Is it in an increasing rate or in a declining rate? Because that is what is very critical for economic development. And ours is at a declining rate. The rate of increase in unemployment is today at a declining rate. Honorable members, the implementation of Great North Transport turnaround strategy is in full swing. Just recently, the Great North Transport has acquired a fleet of new 75 buses, which have since been distributed across the 5 districts. We are in the process.
Right, the Limpopo State of the Province address being delivered there by Premier Stan Mathabatha, giving us a sense of where we are, what's the state of play in this province regarding COVID-19, regarding the vaccination program. We heard from the Premier there speaking about the vaccine rollout, the use of hospitals for vaccination sites, and each district will have this mobile vaccination unit attached to the hospitals as well. The Premier was giving us some figures with regards to COVID-19 and with regards to the active cases as well. It's relatively low. I say relatively in compared to other other numbers in terms of the country. Limpopo currently has, in terms of active cases, over 1,100. So 1,180 active cases is the figure I have in front of me. With regards to the total number of fatalities, it is 1,840. And so the total recoveries is over 58,000. The Premier was talking about daily cases that they have recorded between 90 and 100 daily cases. And he says this is a significant milestone. He was also speaking with regards to the vaccine rollout. Target is 44,000, over 44,000 healthcare and related services workers that will be vaccinated during this first phase. And so far, he says over 4,000 healthcare workers have been vaccinated. So we will keep a close eye on that as well. Get you the big takeaways as well. Busy news day this morning.